with special needs. And I think we're not told what placements and services are available. And that's when the disagreement comes between the team and the parents, I think. That's when you guys come in.
Can you speak up a little bit? We have somebody translating in the background.
Okay.
Thank you very much.
Or can you repeat the question because a lot of us can't hear in the back?
I don't think she's done with the question yet. She's talking about the discussion, if I understand correctly, the discussion is not always there about what all services are
Right,
available.
like when we're talking about placement, what are my options for the child? I'm not told what, if they're telling me, okay, this is where he needs to be. So what are my options? Do I have option A, B, C? Do I get to pick? What I think is, and then also the supports and the services, same thing. We have to go to outside provider to tell us, oh, he needs OT, he needs PT, he needs speech, whatever it is. We're not ever offered anything from the district saying, this is what your child needs, and these are your options, and that's what's available. And that's, I think, a lot of the disagreement comes from.
Well, in an IEP meeting, the IEP team should discuss the whole continuum of services. They should.
It never happens. I'm not sure.
It should. And when they
But
talk
it
about that whole continuum.
It doesn't happen.
It doesn't happen.
It's supposed to.
Well, what do you do when they
supposed
don't?
to.
That's what she's saying, they don't. What would you suggest you do?
I would ask them specifically, can we discuss the full continuum of services at the IEP meeting? And then they can start with general education, then they can talk about RSP, and then SDC, or a combination of the above. But ultimately, after that discussion, it's the district's opportunity or obligation to provide what they consider to be the appropriate placement. That does not mean you have to agree to it or disagree to it. If you haven't been given options, you need to ask about that at an IEP meeting, because they should be discussing that with
I
you.
just feel they're not always open to giving us, putting everything on the table and saying, well, this is what it is, and this is what he needs to, this is what he has to be to qualify for this or this or that. I just don't feel there's, I don't feel like everything is put out on the table, basically. So same for services and for support and things like that. So,
I would just make sure you ask just ask them at the IEP.
so there are requirements.
So I think two things there. It's a very gentle, non-confrontational question to ask. I understand that there's a continuum. What might that look like? I understand that you are offering this, that's the first offer on the table. What are some other options? It's a non-confrontational way to suggest that you're very well aware that there is continuum of services and you want to explore the edges of the box that they've offered. Secondly, I think it's our responsibility to take that feedback and bring that and make sure that when we're doing our trainings that we are focused and we're putting some energy into just this very issue, is that it is whether they've thought about the continuum before they presented it or not, they're not presenting it as though there is a continuum. They're not not making parents a part of that conversation. And I thank you for sharing that, because I think it's a common It is.
Yes.
Is that when you would ask, is there an extensive reading program like Linda Mood-Bell? Is there a non-public agency? Is there a non-public school that would, fit the needs of my child?
You can ask all those in IEP meetings. There's nothing that is really off limits in IEP meetings, but districts do have, or would prefer to provide the services that they have within the district if it can meet the needs of the child. But that's an IEP team discussion. So again, it's something that should be brought up for discussion at an IEP meeting. If you as a parent feel it's appropriate, then nothing should be off the table as far as a discussion.
In another likely conversation, if there are a lot of questions about placement, it's time for the facilitator to step back and say, we need to have an extended conversation around this. Here are the three things that we're considering. Why don't we do a T-chart, look at advantages and disadvantages of each. There should be a long, drawn-out conversation if there are some questions about placements and services, because if you don't leave confident that it's the right service for your child, then that's going to be difficult for everyone, right? So extend that conversation in the IEP meeting. It's scheduled from 8 to 10, and it may have to end at 10, but it doesn't mean that the IEP can't be continued at another date.
Or maybe the district has a program that it didn't mention that can serve the same purpose as another program or something like that. But if you don't ask the questions, you may not realize that that's out there. But it gives the district something else to consider and something else to talk about as well. Is there another question?
Yeah, I kind of have two questions. One, is a behavior support plan independent from an IEP?
No, it is part of the
Okay, and then my second question, back to the placement, for the behavior support plan, they kind of brought up change of placement on that agenda when we were implementing it. And that kind of came off as predetermination of placement. So when should a change of placement be addressed? Like how long should it be given? Isn't it about 6 weeks to determine if something's working?
It's based, change of placement should be based on assessment, first of all. So, as should the creation of a behavior.
Assessment of behavior or assessment of function?
Depending on the reason that they're considering that change of placement. If behavior is the issue that may facilitate or the discussion on a change of placement, then it could be a behavioral assessment. If academics or anything else is the reason for a change of placement, then it would be more of an academic assessment. But it's dependent. But there's no set time frames that anything needs to be in place. But I would say that it needs to be in place long enough for the team to be able to collect the data necessary to make the determination or not if a change of placement is needed. Or in other words, is the current placement meeting the kids' needs? And so if you have a behavior improvement plan that's in place for a week, I wouldn't expect an IEP team to come back to the table and say, oh, we need a change of placement. Now, there are outliers for every single situation. One potential outlier with regards to behavior is if it's a very serious incident that may involve more quickly, but you would be involved in that process as well. Okay? Yes?
So you talked about assessments there. Can you speak to what's the difference between an informal assessment and a formal assessment? And when might an informal assessment be okay, and when might a formal assessment be needed?
Formal assessment would use more norm referenced or standardized type tests, whereas informal may include things such as observations or teacher collected student work samples, for example. FBAs or functional behavior analysis, which is a behavior, are heavily dependent on observations in the classroom of the student's behavior. Another informal one could be parent surveys. If they're looking into ADHD, they're going to give you a survey that, okay, it's going to ask specific questions to see if there is some attention issues. So it could be surveys, which would be more formal, or more informal.
I generally consider them to be a formal, to be considered something that's norm referenced, and anything else could be considered informally with a CMA.
What makes an observation an assessment?
Because you're taking a look at and collecting data on something that would be needed. So it's just a form of informal assessment.
So is there only a qualified person makes an observation that's an assessment, or anybody can make an observation?
Well, it would be a person qualified to do an assessment in that area, in whatever that area may be.
So did you speak to the idea of when might formal be needed, when might just informal be okay?
I would say it's up to the discretion of that assessor and what data they're looking to collect versus what the need that is causing the need for that assessment. If for example, you may not think that you got the eligibility correct, or there's other issues related to eligibility, you may want to do formal assessments by the school psychologist who can make that determination. So it's really up to that service provider.
I'll add one more opportunity where someone might choose to do informal over formal. If in the child's school life, we know the triennial, they've done formal assessments, and those formal assessments have been consistent for a long enough period of time, the team might decide, we have that data, we have those numbers, we need to collect informal data, more informal data, so that we can develop the plan, because to do another formal psychoeducational evaluation is really not necessary because the data's been consistent for 13 years, 15 years. That being, you know.
What about things like iReady or Dibbles, or, you know, are those formal,
those are-
informal?
Those are teacher tools, they're often used.
So informal?
Informal.
There was a question over here. Did you have a question?
Cuando no he firmado un IP,
When I haven't signed an IEP,
cuando no he firmado un IP anual,
the annual IEP,
porque no estoy de acuerdo en algo,
because I'm not in agreement with something,
porque tuve una reunión previa
because I
antes del
had a
IP
previous IEP, a previous meeting before the IEP,
y ellos se olvidaron
and they forgot
agregarlo en las notas.
to add it on the notes.
¿Tiene que ser un amendment en continuidad o
Would that be
continuo en
a
las notas del
continuation with
del
an amendment,
documento?
or would it be a continuation of the document?
So you have an annual IEP,
Ajá,
and then another meeting to continue talking about that annual, correct?
Or-
Okay.
Let me see if I can, or did you mean that you've had an
Okay,
IEP?
when I decided the annual IP meeting, because I agreed on something, because they forgot to add it, something I asked before the IEP. I have to go to amendment or only add it to the note.
So if something was left out of the notes and not considered, and you wanted included in the notes?
In the note, because I not signed.
Okay.
That's right.
There are a couple options. If the team calls an IEP meeting, it would be an amendment that would be attached. Also, if there's something that you're not in agreement with the notes, you have the right as parents to write a document and ask that it be attached to the IEP. Okay? So you could write your version of the notes, or what you think was missing, and ask the IEP team or the school to attach that to the IEP. Okay? But if they called an IEP meeting, it would be added as an amendment. Okay? Or you can just attach them.
Okay, another question is, I do annual IP meeting first, and in 2 weeks, taking triennial IP meeting. And they misstage everything, and put together in only one IP, it's okay? I do say different.
Somehow the
Right.
annual and the triennial dates got really close?
No,
Say that again.
no. Okay. Okay, I have an IP meeting, annual IP meeting, and about 4 weeks later, triennial IP meeting.
Okay.
And they misstage everything, and they put together annually triennial IP meeting, together in only one IP, and I now agree because it's different, annual and triennial.
The reason that they do that is to realign those dates. For some reason, the dates got separate. The annual and the triennial dates should be the same every year. It's just every 3 years it's a tri rather than an annual. So they should be the same. So what they were probably trying to do, and I can't speak for the team, I wasn't there, is just trying to realign those dates. Because somehow, like Gardner said, those dates got really close together. And I don't know exactly how that happened without the specifics.
She mentioned the notes section. Is the notes section a part of the IEP document, like legally? Because my school district's law firm put in writing that it's not. So that is confusing.
Notes are always included.
Are they a part of the IEP document, though, and have legal standing? Because sometimes when they say, like she mentioned, we're going to put that in the notes, well, does that have any legal bearing?
It's documentation of the IEP meeting. I'm not aware whether it is or is not part of, officially, part of the IEP meeting. I would have to check, David, I can get
The
back.
IEP document.
Yeah, let me check and I'll get back to you.
It certainly is, because in the notes.
I would think it would be,
We
because
had
when we
notes
give
and-
parents a completed IEP meeting, we give them copies of the notes, and that's part of the IEP.
Well, we had the notes there from April 2014, in a meeting where they said they were going to assess, and here were the notes, and the administrative law judge saw the notes and that sent the district shift. That's how, you know, it's the principal reason why we won that hearing and told them back last year. So the ALJ sure thought it was part of the IEP.
Question in the back.
Should, for example, should the amount of goals that a child has be the determining factor of placement and or changing placement?
I wouldn't say it's the determining factor, but it can be a factor. But I wouldn't say its placement is strictly based on the number of goals.
It's I think it's the intensity and the needs.
Yeah.
And the number of goals, and some districts will tend to write many more goals than others, and some are writing essential goals because their philosophy is if you write the essential goal, it's going to address all these ancillary issues. But it has nothing to do with if you've got 5 goals in your RSP, if you've got 21, and we've seen that number in the non-public school, those two things are not correlated.
Yeah, I mean, what it comes down to is the areas that those goals are written, and can that goal be worked on and achieved in this setting or this setting?
Okay, so it's more
But
of
not
the-
the number of goals itself.
Okay, so it's more of the setting versus, let's say there's a 5-hour program or a 3-hour program, but, you know, you have 20 goals. It's setting versus time.
That it's, again, it's not a determining factor, but it is a factor that the IEP team at least should consider as part of their offer of faith or their placement.
I think I can speak on behalf of a lot of the parents here, but we're always thinking about how can we be part of the IEP in a way that's most effective. You know, and it's not always more, it's not always better. You know, you want more, but ultimately it's not always better. So you're always looking at opportunities to be able to be more effective at helping your child progress. And I'm sure every family is different, circumstances different, child needs are different, and so on. Are there any best practices or any studies done to really better understand what type of engagement from the parent really is most effective or helps, or sure things that really make a difference? I mean, I don't know if you can speak on that. I know it's a very broad question. But
For me personally, and I've been working in special education for almost 22 years now. I've been, like Gardner, I've been a site principal and shared many, many IEP meetings. The main way that parents can be involved effectively is ongoing communication with the case provider. You don't want to not be involved at all and then all of a sudden be really involved in an IEP meeting. Then there's nothing wrong with that. But if you can build a relationship with the case carrier or the service providers and communicate on a more regular basis, I think that helps the process all along. So that would be my recommendation, is just be involved all year long rather than just at the IEP meetings. And I think that can help facilitate communication. It can help relieve anxiety over things. And if your child knows that you're involved in a productive way, then he or she is going to more likely be successful as well, because your involvement is there. And if your involvement is there at school, it's also going to be there at home. So I think that's what my recommendation would be. Do you have any recommendations?
I just had an emergency IEP. The outcome of all this was I don't know if we're still going to have your yearly IEP. That's what I was told at the end of all this. And the reason that I asked for this, it was here and there and everywhere, like he just said right now. I wasn't so involved. Mm-hmm. He's in 4th grade now, and he started in 1st. So I was just like, oh, they got it. They know what they're doing until now. And now that I saw my son changing, he has ADHD, and changing in the way that he would make up stories that I'm sick, I don't want to go to school. He was put in a combo class, 2, 3, and 4, where the 4th grader were only 2 kids, which was him and the little kid that he's always been having problems with. So I asked the principal, can you please, because there was another combo class 4, 5, and 6, can you just change my son? And she said, I'm not going to do that. And you have to wait until I see if there's more kids coming in and so. She made it into a big thing that I went